What have been the unintended consequences of Canada's COVID-19 response? I'm Marco Perry. Welcome to the Perry Platform. Alright, we're back to our regular scheduled programming now. I finished my book breakdown series and I haven't talked about news and politics for a while, and we're still in the pandemic, so I figured I should touch on that, see where things are, and to update you guys on my thoughts on it. Today, I want to highlight some of the consequences of Canada's COVID-19 response, at least thus far. So, right off the bat, I want to make clear, there is no perfect game plan here. If you look at the world stage, Canada has done pretty well. We are nowhere near the worst. We're not near the best either. I would say we're in the upper middle class here, doing a good job, keeping the country afloat. We do have our casualties, but for the most part, they are contained. Has Canada's response been the best it could be, though? I don't think anyone would say yes to that. There have been many holes here and there. For example, at the beginning, our public health officials were saying don't wear a mask. They were telling you not to, and now they're saying to do it. There's been some tension with that. People are distrusting scientists. There are individuals who are disregarding social distancing and whatnot, some internal conflict, and those should be ironed out. But these issues have been talked about a lot. When it comes to something like shutdowns and the economy and the question of businesses versus saving lives, that's been discussed ad nauseum. I have another question though. If you are deciding between lives and other lives, how do you do the calculus then? If the question at the beginning of the pandemic was, is it justified to shut down the economy to save X number of lives via shielding them from COVID infections? I would say, yeah, it's worth it. I'm always on the side of saving lives, especially in this regard. I had no issue with the lockdown at the beginning, and that might be controversial, but I did feel like we needed it, especially given the uncertainty there. We didn't quite know how bad COVID would be, and we weren't too sure if our hospitals could keep up, and all of this other confusion was layered on top of that. Now we know a little bit more. It's fairly clear that we might not need to do that again. We can probably get by with certain precautions, but given the time and the environment, I feel like it was the right choice even to this day. Now, that's the holistic picture though, and I want to reference what I said a minute ago about lives versus lives. See, some of the other things that were enacted given the shutdowns were not ideal, and I have major problems with them. I was okay with the shutdown in the grand scheme of things, but individual flaws made it far less effective than it could have been, and here is where I get to some of the consequences of our response thus far. The first thing I want to talk about is CTV reporting that Canada has a massive backlog of healthcare issues now. The Toronto Star also reports that we have seen a massive increase in advanced cancer in people. Now, you may wonder, why is that? How did that happen? What does that have to do with our COVID response? Well, it's very simple. Cases that were deemed not essential were put on the back burner, so hospitals could theoretically focus on COVID-19. Now, at face value and at the beginning of the pandemic, I could understand that. The main fear was the curve exponentially growing to the point where the hospitals get overrun. We didn't want people to have COVID and not be able to get medical attention, and that was a valid fear. We know from recent history, though, that that did not happen. It was clear a couple months in that the hospitals could handle the extra work. They weren't getting flooded as we once thought they would be. Now, even though we realize that, these non-essential procedures, they should have been recommenced given light of these findings, but they were not. They were continued to be left on the back burner, and here I should explain something too. Let me break down what non-essential really means. I'm not talking about getting a nose job here. I'm not talking about cosmetic surgery. Non-essential can include things like cancer screening. They're saying if you will not die from it right now, you can wait, because we're afraid of COVID and we don't know if we can handle it. But oddly enough, when we did find out that we could handle it, there was actually capacity here. The hospitals were not overrun. We did not revisit these cases, and that's been a major issue. It's been reported that Ontario halted its screening programs for breast, cervical, and colorectal cancers amid the pandemic. So, if you thought you had cancer, or if you did and you wanted more screening for it, you couldn't get it. That's a disaster. And it even brings into question the validity of the non-essential claim. When you say non-essential, to the average person, they might think we're actually talking about getting a manicure or something to make you look prettier. That's not the case. Non-essential could still be vital to your life and vital to your health going forward. Cancer screening, while may not be considered essential, I would argue is still very important, and it's vital to catch early, because we know how fast tumors can grow. So, shutting down something like that, and calling it non-essential, and telling individuals that they cannot get screened because we're afraid of COVID overrunning the hospitals, even though there was evidence to the contrary, that doesn't make sense to me. Combine this non-essential procedure shutdown with Canada's already long wait list for certain treatments, and what do you get? A hurricane of just malevolence. You get a situation where people are becoming very sick, very worried, very scared, and sometimes they are crossing the border from treatable into untreatable territory simply because we didn't get them seen. If you detect a lump or something like that, and you noticed that at the beginning of the pandemic, fast forward now 6 months later, and you still haven't been screened, you could have gone from being fully treatable at the beginning to now maybe not so much so 6 months later. And I'm sure that's the case for a lot of people. I'm not a chief health official or anything like that, so I may be missing some nuance here, and I'm open to that, but this whole game plan here does not strike me as logical. I'm not too sure why these non-essential procedures are still being put on the back burner. COVID is a major issue for sure. We get that. But there are other major issues too. The world did not stop and just focus on COVID-19 6 months ago. Everything that was still going on in the background continued to play out. The key here, and the fundamental message that I'm trying to get across, is that the cure cannot be worse than the disease. The things we did to combat COVID cannot be more harmful to society than the thing we're trying to stop. And of course, I do think that lockdown and what happened there was still appropriate. We did have to social distance, we did have to shut down certain things, but here, I'm not too sure. I think it's very debatable, to say the least. If we are leaving people to their own devices while facing things like cancer, the screening aspect of it, I can't fully say that the trade-off is fair. Why couldn't hospitals enact some very extreme safety precautions that would allow them to still do their job? Especially when, once again, it was known that COVID would not overrun them. To me, if we thought about it strategically, we could have gotten it done. We could have came up with a better plan. We would want contact tracing. We would want patient isolation. We would want the doctors and the nurses to be gowned up in full PPE. Not just a mask, but a shield, gloves, everything that they could get their hands on. Or maybe even having certain hospitals focus on COVID and allowing other ones to still do the non-essential procedures. There's no reason why every hospital had to be doing their own thing. There was a level of coordination that could have solved the issue here, but it was not talked about. Imagine being that unlucky individual who finds a lump on their body, and when you go into a hospital to try and get screened, you're told, hey, it's not essential, we can't do it for you. And then you find out down the road that, oh, now you have advanced cancer because you didn't get it checked in time, even though you tried to get it checked in time. That's crazy. And it's not discussed enough, frankly. It's a major flaw in the way we've handled COVID thus far. The consequences and ripple effects of this are going to be very severe once we get back on track. We are so backlogged right now that the Canadian Medical Association is estimating that we need at least $1.3 billion in funding to go back to regular pre-pandemic wait times for just 6 procedures. Not even all of them, just the top 6, and that is pre-pandemic wait times too, which weren't always stellar. And I should point out too, these 6 procedures they talk about make up about 80% of the diagnostic and surgical care provided by hospitals, so a big chunk. And those are artery bypass grafting, some form of heart surgery, cataract surgeries, hip replacement, knee replacements, MRI scans, and CT scans. So very major things here. And I want to highlight, they are labeled non-essential, but it's not like getting a breast implant or something like that. These are still very important procedures that have been put off. Then you can add on things like the cancer screening into that estimate, and it paints a very bleak picture. CTV reports that clearing the current backlog that's accumulated due to our COVID procedure or COVID action plan, it would require an additional 307,498 procedures to be performed over the next 1 year. And that's to get back on track. Imagine that. 300,000 people, actually. That's what the number represents, waiting for some type of procedure or treatment. Those are the individuals who we put on the wait list, who we put on the back burner. We told them to hang on. We told them they weren't important enough to be seen right now. The Canadian Medical Association reports that wait times have increased by up to 33 days for a CT scan, 55 days for a hip replacement, and 65 days for a knee replacement. And that's only since the beginning of the pandemic, and I will remind you, some of these items already took forever to get scheduled in the first place, and now we're making it even more unreasonable. There are countless stories of people sharing their experiences with this stalled healthcare, and it's pretty depressing. In my opinion, this was a disaster of a decision, and one that needed more flexibility. Okay, at the beginning, you stopped non-essential procedures, fine. But as we learned more, the plan never evolved here. Non-essential doesn't mean something frivolous. We're talking about cancer screening. We're talking about cataract surgery, hip replacements, actual things that have to be done. The Canadian Medical Association recommends that the federal government create a one-time healthcare innovation fund to help resume healthcare services, to bolster public health capacity, and to expand primary care teams. And that's all very good. I agree 100% with that. They're saying we need this money. It should be given to them. It's a major issue. But oddly enough, we have Trudeau, the Prime Minister of Canada, spending money like it's nobody's problem, but obviously missing this. He's spending money on a lot of things that don't matter as much as getting Canadians the healthcare they need. But still, where is the funding then? As a matter of fact, where is the acknowledgement? Where is even the conversation? When has Trudeau talked about the backlog? He's not mentioning it because it makes him look bad rightfully. These guys need to get their act together and stop putting on a show. Put the money where it has to go. Fork out the $1.3 billion. You've already spent billions more, and get this done. And I will point out too, it could be even more than that, because the Canadian Medical Association said their estimate didn't include further delays caused by a second wave, which we're in right now. And guess what? The plan hasn't really changed either. So we can expect the backlog to get bigger. Maybe it needs $2 billion then. Either way, Trudeau better figure it out. This is a massive disaster and a major fail on our planning. And I'm going to get into quantifying that later. So here's the first point. How many people are going to die or get terminal cancer or not get critical treatment that they needed because it's been halted due to COVID? So we're hypothetically stopping the spread in hospitals, but we're causing all of this fallout. How do you balance that? There was a middle way here, but it was never discussed and strategized. To me, it seems like it's very easy to criticize the American healthcare system for our politicians to grandstand, but when you come down to the issue fundamentally, we're in a similar boat. In America, people can't get treatment. In Canada, people can't get treatment either. The reasons are different, obviously. In America, it's because some of them can't afford it, because it's not paid for by taxes, which is a terrible thing. But in Canada, people can't get treatment because the wait list is too long and the government is not allowing these non-essential procedures to go forward. It's the same problem. People are sick and they're not getting the help they need. Canada really isn't any better. And the crazy thing is that there is a clear solution here. Listen to the doctors, put the money where it has to go, and get things going again. And take all the precautions you can. Figure out a plan. I don't know the exact details here, but I guarantee you, there is a way to get it done. It hasn't, for some reason, taken up the public discussion, and our politicians have failed completely in this domain. Now I want to move on to the second hole in our approach thus far, and there's probably many more others you can point out, but these are the top two. So, there is a growing number of opioid deaths and depression. CBC reports that efforts to curb the spread of COVID-19 through social distancing and shutdowns have kept the Canadian caseload relatively low compared to other countries globally, which is true, but the overall health of the population has deteriorated over the last 8 months, with more people turning to drugs, alcohol, tobacco, and screen time over physical exercise to cope with the stress. So, okay, essentially, Things are feeling pretty bleak right now. People are getting depressed and they're turning to substances for joy. It's one of the issues with maybe conceiving of happiness as your fundamental goal in life, because when it's gone, it's very hard to be happy in a pandemic. You will try to cling to it. You'll try to find ways to get back to that elevated level. And maybe the answer appears to you in the form of alcohol or a drug because it can make you happy. For a period of time though, in the short term. In the long term, not so much, but you desperately want that feeling, that euphoria, so you're willing to accept the consequences even if in the long term they will harm you, because you want that happiness right now so badly. And it's a philosophical discussion that we're not having, once again. So that's a major problem. Trying to orient yourself in life, trying to figure out what's worth pursuing and what's not. There are things you can do to cope with that, other things to aspire to, that could perhaps get you back on the right track. Either way, though, we are in the midst of an opioid pandemic in and of itself. There's another issue running concurrently with COVID. So here's some snippets of data to share. In British Columbia particularly, and it's across all of Canada, but here's the data cited in the article. So, in June 2019, a year ago, there was 76 opioid-related deaths in that month. It's a lot. In June 2020, there was 181. Over 100 more in a month, 1 year apart. That's over a 100% increase there. That's a lot more people dying because of opioids now. CBC writes that in BC, there were more than 100 illicit drug toxicity deaths per month for 6 consecutive months from March to August 2020. And in June 2019, it was 76 for that 1 month, so every month's doing more than that. Then, there were some months that were even worse with over 175 in 2020, May, June, and July. So massive increases here across the board, all directly related to the pandemic and how we've handled it. And of course, this one's harder because we had to shut down. We have to distance ourselves. We have to do these things that are not pleasant. So not as clear-cut as the hospital case. Last week, the British Columbia Coroner Service said over 1,200 people have died of fatal overdoses so far this year. And we're only just finishing up October now. And in all of 2019, that number was 983 deaths. So, as you can see here, we're approaching a massive increase. By the end of the year, it's likely we could see double the amount of these overdose-related deaths occurring in the next year. That's a lot of people, almost perhaps 1,000 lives that were lost via that. And Alberta, the same issue. April to June 2020, 302 deaths. In 2018, that same 3-month time frame, it was 211. Increases across the board, across virtually all provinces here. Then we have other factors that can compound depression, like people being forced to stay in with an abusive partner and whatnot. So, here we have 2 different issues, but fundamentally still connected to one thing, which is your well-being. That has not been considered during our pandemic plan. First of all, your physical well-being in terms of disease and whatnot. The hospital should be able to take care of you. We should not have a backlog of over 300 cases of various surgeries and treatments and procedures because we planned poorly. But that is what happened here. And now the doctors are saying that Trudeau has to pump in $1.3 billion into the system to get things going. He has to do that. There is no way around it. It's a total shame for the Canadian healthcare system to be in shambles like this and not to be talked about. It's a disservice to the citizens. Then we have your well-being in terms of mental health. Of course, that has suffered tremendously, and virtually everyone can probably attest to that in one way or another. Maybe not all to the same degree, but everyone's had to make sacrifices. The fact that there hasn't been a readily advertised model for mental well-being and resources that are better advertised, I know they exist, but to actually get them into the hands of the people who need it, it has to be done. And the fact that we can't have conversations about the philosophy of finding meaning during a pandemic is another issue, because everyone's so caught up in polarization, fighting about whether or not you should wear a mask or not, fighting about whether you have to distance or not. Such basic things that we should all be on the same page about are taking up all of our mental capacity, and we can't focus on the bigger things. That's an indictment on the people. How far we have torn ourselves apart. If you want to feel extra isolated, extra alone, extra sad during a pandemic, one way to go about doing that is to divide the population in half and say that you hate the other side of the political aisle. A complete disaster of a framework, but it seems like we've approached that. Now, back on topic though, we do have to run some numbers to put things into perspective, and I don't have the complete picture, but here's a way to get started. At the time of this recording, there have been about 10,000 COVID deaths in Canada, which is quite massive, it's a lot. But keep that in mind. Here's the question. How many have died from increased opioids and suicide? How many more will die from shutdowns of hospital services that we are calling non-essential? The individuals who could have been saved if their tumor was treated properly 6 months ago. How many people are we going to have like that? I fully understand there is no perfect solution, especially for the depression-related issues. That's very difficult to try and formulate a way out of, but at least for the hospital one, we should be able to improve it. All that we need there is more money, and Trudeau is very happy to spend, but perhaps he's spending in the wrong places. That's an issue at the governmental level. And I don't want to excuse the premiers either. Doug Ford, whoever you have running your province, they have a role to play too. The federal and the provincial and even the municipal, they have to figure out how to deal with this, and they have not done so thus far. Focused on lesser issues and spending on the wrong things, it's been a headache. Trying to get them to focus on these 300,000 Canadians who need a procedure and operation done. It should be second nature, something we can all agree on, but once again, it's taking too long to figure out. Now, on a personal level, there are some issues here too. Fundamentally, we all need to do our part. I see reports of individuals throwing massive weddings and infecting 40 to 50 people at one time. Come on now. That's completely ridiculous. How selfish can you be to think that this is the perfect time to throw your dream wedding? That can wait. People cannot get cancer screening because of actions like that. This can't wait. Your extravagancies can. Get your act together. This is so ridiculous. And even beyond that, people are still fighting over wearing a mask. How crazy can that, I don't know how much crazier the argument can devolve into. It's simply a gesture that protects other individuals, and you want them to do it too because it will protect you. But we're talking about freedoms and whatnot. People are really going down the rabbit hole here when they need not be. I'm not too sure how polarization is ramped up to this degree, but it's stopping us from being logical. It's almost like we're looking for things to fight about, and if one side agrees with something, instantly you have to disagree with it if you oppose them. There's no way to operate in a country. How can we expect the government to perform when at the citizen level we are a mess? Of course, not as bad as America, as many people want to say, but a mess nevertheless. Same with healthcare. Not as bad as America, but still a problem. A problem that should not be swept away by simple comparison. The sooner we get this under control, the better it will be for everyone. There are things we can all do to contribute to that. Being selfish and frankly, a misinformed nut isn't doing anything for anyone. Not even for you. You may feel that you are doing something impactful for yourself, but you're making it worse for everyone, and you are part of the everyone. And be smart. We can get through this, but we all have a role to play. And I would say at the individual level, aside from calling on the government to do what they can do, like putting the money where it has to go, which is fine, we should all be doing that, but you particularly, the place to begin really is education and figuring out the landscape for yourself. There's so much misinformation, largely due to social media. Individuals thinking COVID is not real, thinking it's a hoax, thinking that wearing a mask is a symbol of some type of subjugation. Crazy, radical conspiracy theory-like ideas that have permeated the mainstream. Go beyond your social media feed. Do some real research into it. Listen to experts, listen to people who have debates, try to find evidence, and you will come out of that better than you were before. And this can go for anything, really. To be in an echo chamber, to not have your ideas challenged and to hang on to them as if they are some irrefutable truth is a mistake. You have literally nothing to lose by wearing a mask, and the only response that I can hear from someone is that, hey, if we listen to the government's mandate to wear a mask, what do they force us to do this next? Well, the answer is if they ask you to do something unreasonable next, hypothetically, then don't do that.
But the mask in and of itself is not unreasonable. It's a smart thing to do. Don't make this foolish play because you feel like you are standing up for something bigger. Now is not the time for that, and frankly, it doesn't really make sense either. I'm a big fan of civil liberties, freedom of speech, and all that, and I will always defend it. But here, it's just not really it's a non sequitur. The argument doesn't follow at all. My fundamental message is that we should all be able to be on the same page about this. Why is it political? Why are we drawing party lines here, left versus right, in terms of visualizing the consequences of a pandemic? In what world does that make any sense? There is a truth and we should all be striving towards it. Not these individual interpretations of what is just and what is not. We can have those debates and those arguments, which is good. But for something like a mask, and I keep harping on it, I'm astonished that something so simple is so controversial. There are places in the world where wearing a mask is not controversial. And guess what? They're doing a lot better than Canada and America. And of course, there are other reasons for that. Being on an island, for example, is quite helpful. Being a small place is helpful. Having a populace that is on the same page about things is helpful too. And that's something we can replicate if we try. So, going forward, please let's try doing that. And if anyone has concerns about what I'm saying, I'm open to hearing that, and I want to grant you your platform. But you should offer the same courtesy. If for some reason you are finding it hard to find evidence for your argument, and be willing to change your mind in this regard. So that ended up turning into something like a PSA near the end, but that wraps my thoughts up on what's going on right now. So to summarize, Canada's doing pretty well. Not the worst, not the best, but we're in the middle. It could be better. How could it be better? Let's talk about this non-essential healthcare argument. Let's talk about mental well-being and how we should frame this argument of pursuing happiness. Maybe there's something better to focus on during a pandemic. Let's get some services to people who need them right now because they're feeling very down and no change in perspective is going to help them. Let's figure this out. And going beyond that as an individual, let's all try to find our way to a shared reality. It exists and it's there, but there seems to be some tension between political parties fundamentally that's making it very hard to do so. We have to get past that. We're living in 2020 right now. Why are we still so caught up in tribal mindsets and identities? It doesn't make any sense and it's causing so much harm. There's no benefits in all the harm, but we don't recognize that, and it's a shame. So that wraps up our conversation for today. If you enjoyed the content, be sure to leave a review and share. That'll help us grow. And if you want, you can find me online at perryplatform.org and on social media at perryplatform. Thanks for joining me, and I'll see you soon.